Hello everyone, Dr. Mateus Rocha here again. So today we're gonna start the modules about adhesives, cements, and ceramic. It's a very comprehensive module. So I'll start by showing you some important things here for you to remember, all right? Let's start with the ceramic materials, okay? So you might have seen these blocks flying around in CAD/CAM clinic or maybe in your patient's whenever you're doing the treatment plan. So these are the main ceramics that you're gonna see here in the school, all right? We can also talk about some of the other type of indirect materials such as gold alloys and other types of PFM materials, but let's focus today here on these three materials, all right? So if you take a look on the decision tree and the table that I provide to you, you're gonna see that we have some materials that require different ways to be treated, all right? So for example, this one in the left, this is Empress CAD, this is a lucite reinforced ceramic. So this is a glass-based ceramic, and you know all the difference among those. This is a Emax CAD, which is a lithium disilicate glass ceramic, okay? And this one is very popular use for many things, and you're gonna see also in the spreadsheet. Another one that is very popular is zirconia, okay? Zirconia is a polycrystalline ceramic, so it does not contain glass, and all these properties will make these materials be indicated differently and be used different. So have that information in mind. You're gonna need that for the exercise. All right. Also, I wanna talk about some of the cements that you have in the clinic so we can clear up the confusion before we start. So if you see the cements that you have available in the clinic, especially the resin modified or resin reinforced cements, we have three, okay? We have two ones, they are the green ones, they are used for restorative procedures, okay? So we have Aquaforte and Fuji 2LC. So Aquaforte is a resin cement that is basically self-cure, so you can use in large cavities or if you have to do a protective restoration. So those are the type of glass ionomers that you're gonna use. So these materials is a little bit, let's say, more viscous. The aesthetics are not as good as other materials, but it's a very important material to the standpoint of disease control, to adequation of the oral environment and all of that. The other one that you're gonna see and use a lot is Fuji 2LC. So Fuji 2LC is LC because it's a light cure material. So the main difference is that within Fuji 2LC, you're gonna have some monomers that requires light to be fully activated. So Fuji 2LC might be your first option in class 5 restoration, especially on posterior teeth where you don't have aesthetic concerns. It's the material with the highest retention rate. I'm not saying that composite should not be used, but you have to decide clinically if you're going to use a Fuji 2LC as a resin modified glass ionomer or composite restoration. What is important to understand is that Fuji 2LC is light cured and Aquaforte, you don't need to light cure. You might realize that if you light cure Aquaforte, it might speed up the reaction, but it's because it's causing heat. So I don't want you to overheat the tooth, all right? So there's no requirement for it. But one thing before we move to Fuji Plus, that is gonna be the one that we're gonna discuss more today, I just wanna make clear to you that all these materials, they require these two ones, the green ones, they require the white and green cavity conditioner, okay? This is a polyacrylic acid that will basically prepare the tooth substrate before receiving the glass ionomer. So pay attention and use that in your cases, all right? And just one more important fact about these restorative cements, they require coating on top. So this coating is a resin-based coating that is very similar to a dental adhesive, and you apply on top so you can protect the material during maturation. This coating is to stay there only for the first 48 hours, but it's fine. You're just gonna apply that, protect the material for these first 48 hours, and then the material will set completely. Okay, so pay attention, don't confuse. These items here are gonna be using restorative direct procedures, all right? Not cementation. All right, so now let's go to our cement that we use for luting procedures. So that's Fuji Plus, okay? The Fuji Plus is a resin reinforced glass ionomer cement that is gonna be used for cementation of full metal crowns, PFMs, and also zirconia in some conditions. So it can be used as a luting procedure. Pay attention that the cavity conditioner is different. You see that the bottle is black and pink. This is a cavity conditioner for these type of luting materials. Very nice. Now, just for you to have a quick information how this system works, this is how the capsule works. So that's very important to understand that whenever you have the capsule here, it's going to be in this stage, which is not perforated, and the powder is going to stay on the right side while the liquid stays on the left side, the black spot. When you click that, you perforate and you mix both liquid and powder, and then this is going to go ahead and mix powder and liquid, okay? And then it will be extruded on the capsule. Very nice. So now that you have the information about the resin modified glass ionomers, we're gonna move ahead and talk about the exercise that we're gonna be executing today. And within that exercise, I'll be explaining more about the other materials that you have, okay? So first of all, everyone received a bag containing some materials and crowns. So first of all, you receive 2 mixing tips. They are gonna be for different materials. You have received some micro brushes, some benda brushes, and also together with your bib to protect your and have your station clean, you receive a very interesting design here, which you have 3 crown preps and 3 crowns. So you have a gray crown, you have a very white one, and the other one that is kind of tooth color, okay? So for these crowns, we're gonna cement these 3. So the crown gray will represent the family of alloys in your decision tree, okay? This way you can choose whatever cement you think is the best for that particular condition. The white will represent the classes of the white will represent the classes of zirconia material, polycrystalline ceramics, okay? And this one that is tooth color is gonna represent the classes of glass-based ceramics like lithium disilicate in this condition. So have in mind, you have gray, full metal crown, white zirconia, and tooth color here will be Emax. Very nice. Now, in pairs, you're gonna have a bag that you're gonna share, okay? This other bag contains a lot of goodies for you. It contains dental adhesives. You have also primers, okay? I have different primers. You have acid conditioners that are gonna be slightly different as well. You have cements. These cements, let me open here the screen so you can see better. These cements, you can see that you're gonna have a pink one. This is Fuji Sen 2. It's very, very similar to Fuji Plus, but is a material that is a paste-to-paste, okay? It's just the little sister of Fuji Plus. These are the tips for the acids. You also receive a dual cure cement, okay? And a light cure cement, resin cement. You're gonna notice that based on this exercise, we're gonna have some Easter eggs for you. So some of those materials, they're not indicated for use in this condition that we are going to use today. But I want you to think about and already start writing on your decision tree. Which cements do you think you're gonna use with each one of those materials, okay? So think about full metal crown, zirconia, and Emax. All right, so here we go. So I will start cleaning up the station so we can go one by one. So let's start with the full metal crown. So I will take away everything that I don't need for it. Very nice. I'll put the side here. And I'll keep only the things that I will need. So I'll zoom in here. There we go. All right, so for the full metal crown, you're gonna see that, and full metal crown also represents what would happen with the PFM. So the first thing that you need to do is try in the restoration to make sure that it's gonna fit. So here it's fitting pretty good. And then you're gonna have to select which clinical procedure you're gonna use. If you're going to do a luting or bonding, and if you're doing luting or bonding, which cements you have available for you. So in this case, I will select luting because I have a good preparation here that has all the retention and resistance forms that I require for this prep. So in this case, I'm gonna use this one. So for this material, I'm gonna use a resin reinforced glass ionomer cement, that is the Fuji-Sen 2. So just for you to know, the Fuji-Sen has a dual mix paste, which is a little bit easier to use than the Fuji Plus, okay? The Fuji-Sen 2, we're not having in the clinics because of cross-contamination, but here in the Sim Lab, it's easier to be used, and probably this is gonna be the most popular one that you're gonna see in the clinics around. Also, you're gonna see that in the clinics we have the Fuji Evolve, which is the new generation of this one. Sometimes we use those to cement zirconia. All right, so for this one, what I would need to do is think about that glass ionomer-based cements go with cavity conditioner. You're not gonna have cavity conditioner on your station because this cement does not require cavity conditioner, but in the clinics, remember, you're gonna start with the cavity conditioner on the tooth, getting ready for Fuji Plus. Since we're not gonna have this today, what we're gonna do is we're gonna skip that part. Now, I have everything set for the cementation of the full metal crown or PFM. So what I'm gonna do here is, first of all, I will open the cartridge here and I will put the tip, okay? The tip will slide in and we'll make sure that both barrels are aligned and all good, and make sure that you're going to lock the tip. If you don't lock, when you try to extrude the material will go all over, okay? So here's pretty simple. What I'm gonna do is, I'm gonna have a bender brush here or a micro brush close to me, and now that I have everything ready, I'm gonna start to dispense the cement, so I can put a little bit of the cement somewhere around here, just to make sure that I have enough cement. And see what happened to me, the tip tried to go out. And now I'm going to put the cement on the crown. So you have to start on the margins here of the crown. Make sure to have the tip all the time in contact with the crown, okay? If you don't touch the crown, you're gonna have voids inside, okay? So you just need to fill probably 1/3 to half of the crown. You don't need more than that. Too much cement is too bad. And make sure to have a little bit on the sides here, okay? On the margins. Very nice. So now that I'm ready, I already know the position that I have because I have try-in. I'm going to go ahead, press, and hold, okay? Make sure that you have cement all over, okay? That it's forming this ring of it. So once you have this, you can get the micro brush and start removing the excess, okay? So now I'm going to start removing the excess of cement. Here we are. And then what I'm gonna do is, I'm gonna make sure that I'm not moving that crown, okay? For the first 2 minutes. Because the thing is, you have to ask your patient to go ahead and maintain the bite. So put a cotton roll and ask the patient to bite on it. And then you're gonna keep that. But the first moment, you have to press that crown and stay with that. Okay, so let's speed up this. So I will leave the crown here to set. While I'm doing that, I'm going to start to think what I'm gonna do with the other material. So I'll just put this crown aside and start cleaning my station here. So we're gonna go for the other ones. Okay, so now I have two options here, all right? I have a glass-based ceramic and I have a zirconia ceramic. So first of all, I need to choose which cement I'm gonna use with that. So I have two options, light cure cement and dual cure cement. For crowns where the thickness are more than sometimes 3 millimeters, especially on the marginal ridge area, you very likely gonna use a Verolink Static DC resin cement. Lacquer cements are used mainly for veneers, where aesthetics are very important because you know that dual cure cements, they have more amine in the system to compensate the lack of light that you're gonna need. So you have a chemically cured type of setting as well with the light curing. So this can change color over time. But since we have a crown, the change of color of Verolink DC cement is not that significant. So I can already decide that I'm gonna use a Verolink DC cement, okay? Very nice. So now that I have this, I have to decide how I'm gonna bond the cement to the tooth. So as I mentioned, it's important to use cements and adhesives that are compatible to each other, okay? Since this cement is either total etch or self-etch cement, I'm gonna need an adhesive system to go with it. If it was a self-adhesive, the story is different. But then we have to choose an adhesive system for it, all right? Now, I have also to decide which type of surface treatment we're gonna do on these crowns. So if you think about glass ceramics, they require what we call etching gel, all right? That will, of course, remove part of the glass of the ceramic and leave some crystal particles behind as well, so you can create a bonding to it. So it will basically increase the surface energy of that material. So if you think about the etching only goes to the glass ceramic, because if you have a zirconia polycrystalline ceramic, you don't have the glass to be etched. So you have to sandblast. Okay, so I decided that for glass ceramic, I'm gonna use an etching gel. For the zirconia, I have to do sandblasting. Most of the times, the lab, if you're doing the lab, will do the sandblasting for you. Or if you're doing that on a CAD/CAM setting, you're gonna see that we have a sandblasting machine for it. Very nice. Now, I also have to decide which primer I'm gonna use, okay? We have this one that is monobond etch and prime that is made for glass ceramics. This one is one of the tricks that I put here for you. This etch and prime, it's basically a combination of an acid that is not hydrofluoric acid and silane that you can use at the same time. You can etch and prime a glass-based ceramic. So think about this as a one-step etch and prime of ceramics. Although this product is very good, and then some practitioners might use, we're not gonna use that. In the school, we mainly use the other systems, okay? And then it's simple also to have less type of bottles and different type of materials that can complicate your protocol. So this is just for you to have an attention to it because it's different. Monobond etch and prime is different than monobond plus. So what is monobond plus? Monobond plus is a universal primer that can prime any type of ceramic material, alloy material, or high noble alloy material, okay? So in this one, you're gonna have silane, you're gonna have MDP, and then you're gonna have a sulfide methacrylate that will bond to gold. Very nice. So now what you're gonna do is, since this is a monobond plus and contains silane and MDP, this is gonna go well with the glass ceramic because it has the silane, and this one is also gonna go well with the zirconia because it has 10 MDP. Pay attention that sometimes we have silane, pure silane in the clinics. That only works with glass ceramics, all right? Okay, so I have the monobond plus here. Also, I'll have a phosphoric acid here to use on the tooth. Pay attention, it's different, phosphoric acid and hydrofluoric acid. Hydrofluoric acid, never in the mouth, okay? If you have hydrofluoric acid in the mouth, you might cause a burn on your patient that is severe. I'm telling you, severe. So this also, you need to wear gloves all the time because this is a very, very strong acid. Phosphoric acid, also have to have some cautious with it, but it's less strong. Okay, so now I have everything set here. I have my adhesive system, I have my ceramic etching and priming depending on what I'm gonna do, and I have my cement. So if you think about, this is the order that these are gonna be working. So you have monobond plus for the ceramic, cement in the middle, and the other part on the tooth. So how do I start? you never start on the tooth because you're gonna need more time for it. So what you're gonna do is you first start with the ceramic. So let's start with the glass ceramic here first. So with the glass ceramic, what I'm gonna do is, first of all, I'm going to get the etching here, and then I'm gonna apply the etching on the ceramic. What's important to know is that the etching time for each ceramic is different. So for this one is a lithium disilicate, so we have to etch for 20 seconds. So that's what I'm gonna do right now. I'm gonna etch the ceramic for 20 seconds. After that, I'm gonna rinse this one. So after rinsing and drying pretty well, I have this ready for the Monobond Plus, okay? So the Monobond Plus, the silane part of it will act right now. So what I'm gonna do is I'm gonna open this bottle, okay? You can put that on a dappen dish or something like that, or you can do a little trick here with a microbrush. So what you can do is you bend the microbrush, you never put here on the tip. What you do is you put on the neck of it. So you just go with the drop, and this drop will go to the tip, and that's the right amount. You see here, the drop. This is enough. You don't want to have a very thick layer of monobond, okay? So now you're gonna apply. You don't have to scrub very hard. You just need to make sure that it's in contact to everything, and then you let this sit aside for 60 seconds. This will evaporate the solvent. All right, since I'm gonna do both crowns with the resin cement, I can start preparing the zirconia as well. For the zirconia, I don't have to etch. It's a polycrystalline ceramic. So I sandblast, which this one came already from the lab, sandblasted. So I try in, I pass Ivoclean to clean the crown. Now I'm gonna go with the Monobond Plus. So I'm just getting a little drop of Monobond Plus here. Very good. So now that I have this, I can go ahead and apply the Monobond Plus. Now it's not the silane that is acting here, it's the 10-MDP that is creating the bond with that zirconia, okay? So same thing. So now the crowns are ready for it. When you finish with the Monobond, 100% precision here is close this. I see so many of those open, and once you open this, the solvent goes pretty quick. So you're gonna probably lose a lot of the quality of the material. So all the time you're just done, just close it. That's for all materials that have lead. So Monobond Plus, adhesive, cements, everything, please close it, because otherwise we're gonna lose that material. All right, everything's set for it. So I'll just prepare my resin cement here. So this is pretty simple. You just have a cap here that we're gonna remove, and we're gonna add the mixing tip. You're gonna notice that the mixing tip is a black and green. So this is ready to receive, to be used. Now it's time to do the etching on the tooth, okay? For etching on the tooth, you're gonna proceed exactly like we would do with a adhesive system. In this case, a universal system, I can use either as a self-etch or I can use as a total etch. Majority of the times it's better to use in a self-etch mode, which means that I need to do phosphoric acid on the enamel, and I apply the adhesive system on the denting part and the enamel. So that's what I'm gonna do now. I'm gonna do enamel selective etching on it. So I'll just dispense a little bit here. There we go. Yeah, this acid is a little bit warm, so it's spreading all over. Sorry for it. Just pay attention that sometimes the acids, they are new, so they come pretty strong. So I'm going to do enamel selective etching. Have you noticed that a little bit of that ends up on the denting? There's no problem. It's better to etch that initial part of the denting on the DJ area than not etching properly the enamel. So 15 seconds here, and then I'm gonna wash this on my station, okay? So now after rinsing and drying, okay, that way you don't need to worry about the moisture of the denting too much, so you can dry pretty good. Even clinically, there's no problem. I just don't recommend putting the air too strong on it. Now I'm ready for the adhesive system, okay? So I'm gonna get the adhesive system here. So I got a drop of the adhesive. Now I'm going to apply the adhesive on all surfaces, okay? So I'll start here on the denting. The adhesive needs to be scrubbed. All right, after I scrub my adhesive system here, I need to air thin a little bit. I'm not going to light cure because I will light cure everything together in the end, okay? There are these two ways to do. So let me just close this. There are these two ways to do. Here in the school, we light cure everything together because we don't want to have the risk of having a spool of cement and then the crown not sitting properly. Okay, so let me air thin this. All right, now that we have the adhesive here, it's time to do the cement, all right? So what we're gonna do is we're gonna get the Verolink DC cement and a bender brush, and we're gonna cement these two crowns at the same time, okay? I'll start with the glass ceramic. So in this way, I'm going to go ahead and extrude a little bit of the material here. And the same principles that we use for the cementation of the resin, using resin modified glass ionomer, we're gonna use here, okay? So here we go. I'm going to apply the cement. So you see that I'm focusing on having the tip in contact and trying to make sure that I go around the corners here because I want the material to be extruded on the margins, okay? So make sure to have a little bit of the materials coming towards the margin. Don't want to put too much cement because excess of cement is a problem, okay? Then you can spread a little bit here. This is a dual cure cement, so once you start working, you need to go fast because probably in 2 minutes this material is going to be all done. So I will put this one first, and I'm going to go for the second one. You can do one at a time if you want, okay? And also remember, we are using zirconia here. So zirconia, not necessarily you need to use resin cement. You can lute that with a resin modified glass ionomer. So think about the protocol that I'm showing here and think that if you need a resin cement here or if you need a luting agent. So you can change the protocol a little bit because then you have all the options. So here I have the zirconia crown. I will press, okay? So now it's time for cleaning the excess of cement. I'm gonna use a bender brush, so hold on the crown, then use the bender brush to remove the excess of cement. All right, that's why rubber dam isolation in adhesion is pretty good because you see that I have excess of cement on the, in this case will be the gingival part. So if that's on the rubber dam, that's fine. And I'm pressing here because I need to make sure that everything is well seated. Okay, let me remove the excess of cement here. All right, so once I'm done on removing the excess of cement, I'm ready to light cure. So to light cure this, you're gonna have to start on the occlusal with your curing light and light cure for 20 seconds. So I will light cure here. So 20 seconds on the occlusal. Then you move and do 20 seconds on the buccal and 20 seconds on the lingual. All right, so you light cure every 20 seconds here. Now I'm gonna do the same thing for the zirconia. And you might be asking, Dr. Rocha, why 20 seconds? Well, I previously calculated that. So you need to go ahead and think about what is the power that you have on your Velo cordless light or corded light, and what is the thickness of your ceramic. I'll tell you that ceramic has about 3 millimeters, so you have to think about for how long you should cure these materials, okay? So once everything's set, you're ready to go. Okay, so you're gonna show this to your faculty, okay? You see a little bit of excess of glass ionomer here, so you can go ahead and clean. You can put a little bit of water and clean the rest of the excess of cement that you have. Make sure that everything is clean and nice. So you show your faculty will grade you and also talk with you about the decision that you had for the protocol. And after you're done, you can save this as a souvenir, take a picture, put on Instagram, just tag Dr. Oliveira on it. Or you can also do a quick testing here. So everything's set, so have fun. Try to remove the crowns, okay? I'm not gonna get this and remove now, but try to remove and see which one you think is gonna be the easiest one to remove. All right? So have fun.